if you want, how these cells and tissues are composing into breast. These ducts are where 78% of breast cancers could occur. So majority of the chances for breast cancers to occur are in the ducts and is known as infiltrating ductal cancer. So in breast cancer also there are subtypes. Now, cancer in developing cancer, which develops in the lobules, is termed infiltrating lobular cancer, which is about 10 to 15% of breast cancers. So you could see here 78% breast cancer takes place in the ducts. 10 to 15% breast cancers are in lobular region. So another type of breast cancer is, which is quite rare, inflammatory breast cancer. That is often misdiagnosed and is always dangerous. So sometimes when there is diagnosis for breast cancer, there is risk also when there is misunderstanding during diagnosis, and that is here inflammatory breast cancer. So next is invasive breast cancer cases. By the way, what I'm presenting here, they are all purely based on real research and analysis with proper references. If you want, you can go and visit Cancer Research UK, which is one of the biggest financing organization for cancer research. So invasive breast research, the breast cancer cases, the percentage distribution by anatomical site, 52% is breast overlapping and unspecified. Then 25% upper outer quadrant breast. And here, lower outer quadrant of breast, 5% here. Nipple and areola, 1% here. 4% central portion of breast. So here. Then 4% lower inner quadrant of breast. 8% chances of, like 8% of the breast cancer could be present here. That is upper inner quadrant of breast. So this is what you could see, the percentage distribution and location of the breast cancer in different regions of the breast. Now, causes and risk factors related to breast cancer. First is always that is personal and or family history. Second, not having children. Third, having first child after the age of 30 years. Then fourth cause, the radiation therapy to chest or upper body for any other purpose. Fifth is overweight and or obesities. Sixth, age. Seventh, late menopause. Eighth, diets high in saturated fat. 9, sexual activity. 10th, ERT. Now, if you want to present as a graphical way of causes and risk factors. Then here it says personal history of breast cancer, breast tissue density, family history of breast cancer, age and gender. Now, what are the symptoms associated with breast cancer? So early breast cancer has little or completely no symptoms. It is not painful in the early stage, but it is very unusual to say there is no symptoms. There is always symptoms, even in early stage also, but mostly the people used to ignore some of the basic issues, basic problem. They consider it as minor problem. Second is breast discharge, especially if only from one breast. Third, sunken nipple. Fourth, redness changes in the texture. If there is some kind of change, abnormal change from outside, you could feel there is something going on. Then puckering, usually caused by a skin disease, but sometimes can be associated directly with breast cancer. Lumps on or around the breast, other lumps around the upper arm or collarbone, which don't go away. Now, this is lump. Then pulled in nipple here. Then dimpling here. Then dripping here. Then redness or rash. These are some kind of basic symptoms. Then skin changes. So here this portion is changed from the other side of the breast. So these are very small and the symptoms which can be identified from open eyes easily. And then breast cancer symptoms and the risk factors. First thing, dense breast tissues. Redness and swelling can also sign of breast cancer. Early onset of menstruation. Then late menopause. Hereditary cause. Exposure to carcinogens. Use of oral contraceptives. New lump or mass in the breast can be indicative for breast cancer. Drinking of excessive alcohol could also be a kind of risk factors. So now various types of carcinomas. In case of breast cancer, you can see serous carcinoma with nipple retraction. Then medullary carcinoma, common in middle age. Inflammatory carcinoma, stage 4, T4D here. Another case of inflammatory carcinoma, this one. And different stages of breast cancer, which starts from 0 to 4. Stage 0 is non-invasive breast cancer, that is carcinoma in situ and with no affected lymph nodes or metastasis. This is the most favorable stage to find breast cancer. So if you detect at this stage, you are lucky and get immediately and easily diagnosed with less expensive diagnosis. Stage 1 is the breast cancer that is less than 3/4 of an inch in diameter and has not spread from the breast. Stage 2 is the breast cancer that is fairly small in size but has spread to lymph nodes in the armpit, or cancer that is somewhat larger but has not spread to the lymph node. Now, stage 3 is the breast cancer of a larger size, greater than 2 inches in diameter, with greater lymph node involvement, or of the inflammatory type, spreading to other areas around the breast. Stage 4 is the metastatic cancer, a tumor of any size or type that has metastasized to another part of the body, for example, bones, lungs, liver, brain. This is the least favorable stage to find the breast cancer. Now, stages of breast cancer in terms of picture, 0, you can see something here. Then stage 1, 2, 3, 4. So stage 0, abnormal cells in the duct lining or sections of the breast, increased risk of developing cancer in one or both the breasts. Now, stage 1 cancer, and this is like, a 0. Stage 0 has 100% survival rate. Stage 1 survival rate 98%. Here, cancer in the breast tissue, tumor is less than 1 inch across in size. That is what here you can see, red color thing. Then stage 2, which has survival rate of 88%. Cancer in the breast tissue, tumor is less than 2 inches across in size. Cancer may spread to the auxiliary lymph node. So you can see how they are spreading from one part to another. Now, you can go stage 3. Tumor is larger than 2 inches across in size and cancer has spread to auxiliary lymph nodes. Possibly dimpling, inflammation, or skin color changes could also happen, as you can see here. And here the survival rate is 52%. Now, cancer in stage 4, breast cancer, it has spread beyond breast. For example, you can see how it looks like outside the breast region and to the other nearby areas of the body. Here, survival rate is list, that is 16% only. Now, metastasis, here lymph nodes under the arm or above the collarbone on the same side as the cancer, brain, bones, liver. So, for example, why is metastatic breast cancer a problem? Metastatic breast cancer is the main cause of death from breast cancer. A third of women with breast cancer will also have metastatic breast cancer later in the life. Treatments are not targeted or very effective at this stage. Now, you can see possible symptoms of metastatic cancer. For example, general symptoms, weight loss, fatigue, lack of appetite. Then metastatic site symptoms, example, bone pain after cancer spreads to bones. So breast symptoms, recurrence of a previous breast cancer. And then symptoms of complications, which is highly complicated thing in terms of diagnosis, spinal cord compression, pleural effusion, cardial effusion. Then we could see these are more scientific, but up to this slide, this is like for everyone who is interested in science or not. The people who even don't have basic knowledge of science, but they could understand and listen up to this slide. But those people who are interested, then here it comes more scientific, which I will be extending in the next videos. So I